And welcome back to COVID-19 and Communities of Color. We want to get to some questions directly from our viewers, and we are going to start with Terry from Adams County, who asks, why can't people over 65 with COPD and diabetes get a COVID-19 shot? Pennsylvanians over 65, though, are in Group 1A, so are people with serious health conditions, but a lot of people are having a tough time getting scheduled. Any advice for that scheduling? And we'll start with Dr. Limon.
So I'll share the good news. So the DOH just came up with new recommendations for large health facilities, or I should say systems and pharmacies as of this week. So rather than addressing the problems behind us, I think the audience will be glad to know that as of this Friday, they will be required to offer the vaccine. I think just basically one of the complications that people should know is that we have not had a vaccine like this for adults in decades, where there are 2 doses that are required, where sub-freezing temperature is required to store them, whether you have to get the second dose within a small and narrow time frame. So those were some of the limitations, but hopefully those will be addressed within the next few weeks.
Oh, that's good. Carol from Dauphin County asks, why are the vaccines being offered to people of color through Black and brown organizations within their communities? Dr. Henderson, I think they want to see more outreach.
Yes, and I agree. We do know that in the communities of color, disproportionately affected, as you stated in the very beginning, we often have high blood pressure, diabetes, obesity, and chronic kidney disease. Those 4 conditions are more prevalent in our communities of color. And with COVID-19, when you have those conditions, more chance of dying. So we need to reach out to the communities that are affected the most. We need to go to the community because they may have lack of transportation, lack of access. So mobile vans, we're being talked about at Penn State Hershey. So Penn State Hershey has developed a mass vaccination site at 5 different areas as of starting the next 2 weeks. So I think most health systems are reaching out to the communities.
Okay, we're getting down to one of our final questions. Another viewer asking, do you think the COVID vaccine will fall under the annual vaccine category like the flu? Dr. Livingston.
I think that it will. I mean, we know that the vaccine efficacy, based on what we currently know, is about 90 days. So we don't know if the immunity wears off. And just like the flu vaccine, where you have to receive an injection annually, we suspect that the COVID vaccine will likely be necessary every 1 to 2 years.
Dr. Hamlin, one last question. Andrea from Dauphin County is worried about her mom. She's 80, underlying conditions, high blood pressure and diabetes among them. She should be concerned about the side effects from the vaccine.
Most important thing is to think about you're weighing risk versus benefits. And so here you're weighing the risk of your mom getting COVID versus the risk of side effects. And so if your mom has been trapped in the house for the last year for fear of getting COVID, rightfully so, the vaccine is the way out.
And so there we have it. Hopefully that vaccine distribution will get a little bit better as we go on through this pandemic. I know Pennsylvania was having a tough time getting its allotted amount, so hopefully we can see it soon. I want to thank all of you for joining us tonight, all of these doctors who spent their time and their facilities who were kind enough to let us borrow them, and hopefully we get the information out that people need to know and that you, a viewer, will consider getting the COVID-19 vaccine. Thanks for answering all the important questions for the viewers, and thanks for watching. Have a good night.